Today we will talk about the patent ductus arteriosus. Here let me explain first. I have drawn this diagram upside down. Here we have the ventricle, atrium, aorta. This aorta. Here this is the aorta. This is the pulmonary artery. Here this is the pulmonary artery. Then we have this ductus arteriosus. Here from the pink color, if I focus here in the pink color, it is the ductus arteriosus. So what actually happens is, at birth this ductus arteriosus narrows down and eventually forms a ligament, which is known as the ligamentum arteriosus. But in some cases this does not closes, and hence the blood is continuously passing through it. Now you all must be thinking that what is the use of this ductus arteriosus in the fetus. So basically what happens is, blood enters from this side into the right atrium, then from the foramen ovale it goes to the left atria, and then to the here and back to the systematic circulation. But the blood that cannot cross the foramen ovale, whatever the reason is, that gets down into the right ventricle and then pass through the ductus arteriosus. If you remember the embryology, then during cardiogenesis, here we have one septum, here we have another septum. Here it is the atrial septum, and here we have the ventricular septum, which in between here there is an endocardial cushion, which leads to the fusion of the septum at birth, because after the birth the baby lies on the oxygen, its lungs get inflated. As you know, in the fetus gets oxygenated blood from the placenta. From the placenta, then from the placenta the blood goes to the umbilical vein, and then it enters the right atrium. Now in order to bypass the lung, here we have foramen ovale, and it passes through foramen ovale and then to the rest of the body. But soon at birth everything changes. It's like at the birth this foramen ovale closes by this foramen closes, and here the ductus arteriosus also closes. Now what are the mechanisms that leads to the closure of this? During embryogenesis, I would say that this foramen ovale and ductus arteriosus are kept open with the vasodilator known as prostaglandin E2. So soon after the birth, the PGE2 level falls in the blood. The lungs also releases bradykinin in order to facilitate the process of constriction of this duct and the closure of the foramen ovale, because at the birth the lungs soon get inflated, oxygen levels in the body goes rapidly high. Now if this ductus arteriosus do not properly close or constrict, then the baby leads to the patent ductus arteriosus, which means that open ductus arteriosus. In a normal physiological process, this ductus arteriosus is replaced by ligament, as I told you in the beginning of the video, with the ligamentum arteriosum. OMG, these names are so difficult to pronounce. Anyways, now here about the pathology. About 10% of the babies are with the ductus arteriosus, but the other 10% is associated with other conditions, that is the congenital rubella syndrome, that is the mother catches the rubella virus during pregnancy. So basically what happens to the babies that are born with the patent ductus arteriosus? Now the lungs are fully inflated, the blood comes from here, the deoxygenated blood crosses the right atrium, the right ventricle, and then, as you know that the pressure is higher at the left side of the heart, that is the left ventricle. So what happens is, when the deoxygenated blood crosses the right ventricle, it gets into the lung, it do not enter the ductus arteriosus. But what happens is, when the oxygenated blood comes back to the right atrium, then to the right ventricle, and then to the aorta. Because of the high pressure in the right part of the heart, the blood re-enters into the ductus arteriosus and gets a second trip back to the lung. Now, as you know that if the body, if the deoxygenated blood, if you have studied about the atrial septum defect or the ventricular septum defect, then what happens is deoxygenated blood gets directly from here. Deoxygenated blood crosses this foramen ovale or crosses this area and supplies to the body. In that condition, the baby was developing cyanosis, that is the blue color. But in this case, the oxygenated blood is not going to the body, so in this case, we will call it acyanotic. That means not blue color. Now later in life, change in shunt could happen. In this case, you can see that the blood is moving from the left side to the oxygenated blood is moving from left side to the right side, and then making a second trip to the lungs. But what happens is that in the later state of the life, at the early stage it's asymptomatic. At the later stage in life, there is increased pulmonary volume. There is increased pulmonary volume because the blood is keep moving here. That could lead to the pulmonary hypertension, and that then at this side the pressure will increase dramatically, like it will lead to very increase in pressure. So this will make a change in shunt from right to the left.